Assalamu alaikum and welcome to today's episode of Health Check. I am Kan Suga and joining me is a special guest as we dive into the most relevant issues to many new mothers, and that is postpartum hemorrhage, many refer to as PPH, characterized by excessive bleeding after childbirth. This condition takes necessary, timely attention in understanding the health and safety of both mothers and children. In the next 30 minutes, we will look at exactly what postpartum hemorrhage is and considering its causes and risk factors. We'll also go through the recent strategies regarding its treatment and prevention. Whether you're a parent, aspiring healthcare professional, or anyone merely interested in the subject, this episode will be one of the many valuable lessons in that condition, though affects many and is greatly under-discussed. So listen close as we bring to light one of the most important parts of maternal health. Yes, as I briefly mentioned earlier, we are thrilled to have a distinguished expert with us today to provide valuable insights in postpartum hemorrhage. Joining us is Dr. Becca Akatulinda. Dr. Akatulinda will help us understand the complexities of the matter that postpartum hemorrhage is, and he will also share the latest treatment strategies and prevention. Please join me in welcoming Dr. Akatulinda to Health Check.
Thank you so much. Akatulinda Becca are my names, and I'm privileged and glad to be here. Thank you for hosting me, and thank you for inviting me to share this important topic, important condition, yet very under-discussed. This PPH, by definition, is a severe bleeding from the birth canal after delivery, after childbirth.
Yes.
In the case a mother, after giving birth, is cut by a knife on the throat and she bleeds to death, is not PPH. So this specifically is the bleeding caused by childbirth. So that's what we call postpartum hemorrhage, PPF. And that's what we're discussing today because it is a serious condition, has led to many deaths of many mothers in Africa. So it is worth discussing.
Yes. Well, our viewers, there you have it. PPH or postpartum hemorrhage is a bleeding that is caused by childbirth, not any other injury. And Doctor, to start our discussion today, could you enlighten us regarding the causes and maybe the risk factors of postpartum hemorrhage?
Wow, very, very important. Once there is a problem, it behooves us to look for the causes of it so that to prevent it. And therefore, let's delve very fast into the causes of this dangerous condition, which has claimed the lives of many mothers in Uganda, in East Africa,
and the rest
and
of
in
the
Africa,
world.
across the world.
Yeah.
As we talk, I will not hesitate to mention the point of delay. Most of the causes of these diseases in Africa is delay to seek medical care. And so, delay to go to hospital or delayed labor is one of the causes of this postpartum hemorrhage. I also will mention other conditions like uterine atony. This is the failure of the uterus to contract. Normally, when a lady has given birth, it is normal, it is expected of the uterus to contract.
Yes.
And in the contracting, it now stops the blood from flowing.
Yes, this contraction is the one that pushes the baby.
Yes, even after the baby gets out already, the uterus itself has to contract.
Yes.
Remember, if I can demonstrate, the uterus is always, when there is a baby inside, it is enlarged.
Yes.
And therefore, it is holding the baby. Now the baby has moved out past the placenta.
Yeah.
Now we expect the uterus now to contract and go back. In doing so, it will close the nerves, sorry, the blood vessels, and blood will not be coming out.
Yeah.
Now, in the cases it doesn't, then blood will continue coming.
Will continue flowing.
Yes, the blood will continue flow,
Yes.
bleeding until she dies. It's what you call the PPH, postpartum hemorrhage. Also, I can't fail to mention the point of retained placenta. When a lady gives birth,
Yes.
the baby comes out first. Next is the placenta to come out.
Yes.
Now, in cases where, for example, this mother has given birth in not in hospital setting, and maybe the traditional or the village birth attendant mistakenly or unskillfully doesn't remove the uterus, sorry, the placenta.
Yes.
It will cause the bleeding to continue until the woman passes on. So retained placenta is also a very important point, causative factor for this PPH. Also, I can't fail to mention the point of coagulopathy. Now, this is a medical term which may be hard, but
Yes.
I'll explain it.
Yeah. Mind-blowing.
I'll break down for you to understand it very well. Coagulopathy comes from coagulation.
Yeah.
Usually, under normal circumstances, when there is bleeding, blood should clot.
Yes.
For example, if a tree or anything or any harm injury happens on the skin or anywhere, the blood is responsible for clotting. Now, coagulopathy means there are problems or there are challenges, difficulties in the blood clotting. Now, that condition is problematic in any way that when a woman has bleeding, it will continue without stopping. So that coagulopathy can also lead to PPH. Another point I can't fail to mention is infections. This is very common among our women, especially in our third world countries, or let me say, in our developing countries. A lady has her malaria, she does not treat it, it becomes severe. When she's giving birth, the baby may come out well, yes, then she bleeds to death. Diseases like untreated PID. PID is pelvic inflammatory disease. Now, that's a broad topic which we'll discuss maybe later, but PID, there are diseases in the reproductive system of a lady.
Yes.
Be it in the ovaries, be it in the fallopian tubes, be it in the uterus. Now, in the uterus itself, if it is there, the infection, it will bring about bleeding non-stop. And we may end up losing this woman to PPH because of the infections. There are very many causes, very many factors,
Yes.
but those are a few common ones which cause our ladies. Before I finish, there is poorly managed labor. When a lady goes to hospital or when a lady is giving birth, there are certain procedures we carry out to help the event be fine, be normal, be okay. Now, in the case anyone attending to this woman, this mother, misses those procedures we do, bleeding may not stop, and we may end up losing this mother. So those are the commonest causative factors leading to PPH among our women and leading to many deaths in Africa, for that matter.
Yes, all the midwives out there and expectant mothers, those are some of the causes that you should watch out for in order to curb the issue, which is postpartum hemorrhage. Doctor, could you describe some of the symptoms? Because we all know bleeding after childbirth is somewhat normal and not scary. So could you maybe help us throw more light on what to watch out for so that the victims may know that now I'm going through this heavy bleeding, some of the signs and symptoms, so that our midwives and the mothers should be more vigilant?
Thank you. Very, very important, very significant in managing this, because like you said, it's absolutely true and normal for any lady to bleed after giving birth.
Yes.
Definitely. It will be a myth for tell you that a woman gave birth and there was no blood. That is impossible. And
Yes,
can't happen.
exactly.
And therefore, bleeding during childbirth is normal. Now, when it becomes abnormal is when it can cause problems, and is when we refer it to as PPH. Now, a woman should not bleed more than 500 mils. That's like a half a liter, yes. You shouldn't exceed that when she is giving birth. Then also too, she shouldn't take more than 30 minutes bleeding. No.
That is after the
giving
labor.
birth, yes. Yeah. We expect bleeding to happen after a few minutes. It ends. They try to pad the hand, and the bleeding later stops.
Yes.
Once you see it is beyond 30 minutes and blood is still coming heavily, a heavy blood through the birth canal, then you may begin suspecting to be a problem. Another symptom is when a lady looks pale.
Yeah.
You check in the hands, they are pale. You check on the tongue is pale. Even the face, then you can easily detect that the blood she has lost
is too much
than expected.
Yes.
Then it becomes PPH.
Yeah.
It is now a call for a person or a midwife attending to take action. Another point I can't fail to mention is when a woman loses consciousness. It is not normal. It is absolutely abnormal for a woman to give birth and she loses consciousness. If it happens, it's a call for emergency for the midwife to ask herself, why should this mother lose consciousness after giving birth? Perhaps she has lost more blood than expected. Also, there's another point of decreased blood pressure. In all labor wards, labor rooms, there are blood pressure monitors. The importance of those monitors is for us to continue monitoring our mothers, our patients who have given birth. For us, the medical usually say our mothers,
yes.
But patients who have given birth, mothers who have given birth, to monitor their blood pressure. The moment the blood pressure is decreased, is abnormally low, it might be a call for finding out if she has lost blood that is more than required to be lost. As I finish up on this point of symptoms, we can also talk about increased heart rate. Now, because there is less blood in the body after losing blood, the heart tries to pump very fast to give blood to body organs for them to work well. Now, this heart rate, when it is increased abnormally, is a sign for us to think twice and say, why is this heart rate high? Could it be because of loss of blood excessively? Then we go and delve into other investigations for this PPH. So those are the few commonest symptoms where a midwife or anyone attending to a delivering mother can tell that there is a risk or a mother has already developed PPH.
Yes, all the nurses and midwives out there, those are some of the symptoms you should watch out for, so that we help curb this horror, especially in the developing countries, since it is one of the biggest causes of maternal mortality. Dr. Becker, could you please walk us through, maybe briefly, how this hemorrhage, postpartum hemorrhage, is diagnosed, the assessment strategies, and maybe the tests performed, so that it is confirmed that this patient is surely going through PPH?
Yes, thank you. Basing on what we have discussed, the signs and symptoms,
yes.
When we detect any of those or some of those signs, then it is a call for us as medics to look for diagnostic measures to see how do you confirm it is really this one.
Yes.
Now, one of what we do is clinical evaluation.
Yes.
We can evaluate the woman after giving birth. We see her pressure, we see her temperature, we see her heart rate. Then we can tell that this might be PPH.
Yes, in other words, what you're trying to say is after giving birth, this patient should be highly monitored, like every minute, so that the vitals are taken and everything.
Absolutely.
Okay.
That's why after giving birth, we return them in the hospital. We tell them to keep in the ward.
Yes, for some
From
time.
the labor room, we take them to the ward, and we monitor them.
Yes.
What you want to do is to find out if PPH is coming in.
Oh, okay.
Yes, when it is coming in, then we handle accordingly. But also, we can also do some tests like ultrasound scan, because when you do the ultrasound scan, we can tell how the uterus is. Remember, we said among the causes of PPH is difficulties or problems in the contraction of the uterus,
Yes.
or challenges in the uterus. Now, for example, we talked about retained placenta or products of conception. Now, when you do scan, ultrasound scan, it will tell us that there is something remaining in the womb, in the uterus, which now we go in to work on so as to remove or to stop this PPH. So ultrasound scan is very important after mothers have given birth for us to confirm how the uterus is. If a person is able, we can also do a CT scan to assess the uterus, the abdominal region, to see how it is, or if possible, an MRI. Also, because we are in this disease, this condition is including blood, is involving blood, we can also do laboratory tests. For example, a full blood count called FBC, also known as complete blood count, CBC. This CBC will tell us the amount of blood levels that the mother has, and we shall be able to tell that according to this CBC report, this lady has lost more blood than expected. Then we can tell the PPH has set in, or we can tell that PPH is about to set in. Then we can handle accordingly. Yes.
Yes, thank you so much for that insight. Once diagnosed, what are the main treatment options available? Or once the patient is confirmed to be going through PPH, what are the main treatment options available? And how do these Medicare providers determine the best course of action?
Yeah, thank you so much. Number one, PPH is an emergency.
Yes.
In a medical treatment, we categorize diseases and conditions according to the risks of death to the patient. Now, PPH is highly fatal. It can kill very fast. And like I said, very many mothers in Africa, especially in Africa, have died because of this. So it is among the treatment plans, we brand it or we label it emergency. So therefore, whichever person is working on this person should work on it as emergency. Not first wait, do this, slowly. No. A mother can die, a life can go. So it is emergency. So in doing so, knowing that it is emergency, now we arrest bleeding as fast as possible by assessing the cause of this bleeding. We said the PPH is the excessive loss of blood after giving birth. So we have to ask ourselves, why is this mother losing blood? If it be anything retained in the uterus, we work on it. If there is retained placenta, then we make sure we work on it. So we look for the cause of the PPH and work on it. There is also what we call oxytocin injection. This is one of the essential medicines in every labor ward. Any labor ward without oxytocin is not worth being called labor ward. Now, this is where we discourage mothers from giving birth outside hospital. Because in the case of this condition, they won't have oxytocin. Oxytocin is an injection, is a drug, a medicine, which is injected in a person's muscle, and it goes directly to the uterus and helps it to contract. So we give oxytocin as soon as possible to work on it.
Yes, this oxytocin is intermasticular.
Yeah, intermasticular, yes. It's not for swallowing, it's not for
IV,
vein, no, it's intramasticular.
Intramasticular,
yes. Giving in the muscle. Also, before I finish on this management plan, like I said, emergency, you handle extra blood, you arrest bleeding by stopping bleeding, giving oxytocin, finding out the cause. Also, treat any infection
Yes.
in the mother which could be causing this. Before I finish this, an ultimate, or let me say a saving intervention is not all those things I've mentioned. Once it has happened, the only solution is give blood immediately. So we call it emergency blood transfusion. Now, I would not forget to mention that this is why I said a mother must give birth inside the hospital. For us doctors, when you come to hospital to give birth, we know what to do because we expect anything to happen, and therefore we shall have done CBC, we know your blood group,
Yes.
we know such things.
Yes,
And
in
there is-
the patient's records, everything
Yes.
is
So that, God forbid, in case this PPH sets in, we give emergency blood transfusion.
yes,
We give immediately the blood very fast to stop death.
yes,
Because if you don't give blood, a mother will just die suddenly
yes,
and you lose her.
yes,
So emergency blood transfusion
yes.
is very important in managing this PPH.
Yes. Yes, for our dear viewers, those of you who are just joining in, we are discussing a very crucial matter in maternal health, and that is postpartum hemorrhage, which is excessive bleeding after childbirth. We've talked about its causes and symptoms. And doctor, postpartum hemorrhage is really a serious condition, as I'm sure many of our viewers agree. Could you explain maybe some of the potential complications that may arise in case this PPH is not managed properly?
Yeah, thank you so much. Like we have seen, this condition is terrible. It's very unfortunate. We're losing very many mothers. So allow me to mention the complications
Yes.
not in order.
Yeah.
I begin with the most terrible one, death.
God
PPH
forbid.
kills. A mother can die.
Yes.
After giving birth to a beautiful baby girl, a handsome boy, after giving birth to your son or your daughter, your wife can die. And it is so fast. As soon as PPH sets in, she loses blood and continues without intervention, she dies. So it is also terrible. Now, apart from dying, apart from death, a woman can get into shock. Shock is when a person loses consciousness due to lack of blood supply in the body, or oxygen supply. Because the oxygen is not enough, because as we understand, blood transports oxygen to all body parts
Yes.
and all organs for them to function. Now blood is not in the body, so the body gets into shock. A person also can get organ failure. As we know, our body organs use blood to survive. Now blood has gone out, so some organs like kidneys and they can get into failure.
Yes.
And that will be terrible. That will be very bad, a complication for the mother. Also, cardiac arrest. In my explanation earlier on, I mentioned and said, one of the symptoms of this PPH is a high heart rate.
Yes.
I explained and said the heart is responsible for pumping blood. Now blood has gone out, is not enough. So the blood tries by its means so much to pump blood very fast. The little that is there, to pump it very fast to make saturation is in the body. Now in doing so, the heart can go into what you call cardiac arrest. So you can get a heart problem from this PPH. There are very many complications, but I'll end at that only by mentioning this last one, respiratory distress. Because there is not enough oxygen due to low blood in the body,
Yes.
and we know respiration works on oxygen and carbon dioxide being exchanged,
Yeah.
so we can get respiratory failure.
Okay.
All of these complications may lead into death of the mother.
Yes, our dear viewers, this is a really, really serious matter. As the doctor stressed earlier, it is an emergency, so which highly calls for prevention, since we all know prevention is better than cure. So, doctor, what are some of the key strategies in preventing this PPH?
Yeah, thank you. PPH is very preventable.
Yes.
Very, very preventable. And this calls for all of us, whether you are a mother, whether you are a young girl, whether you are a young man, whether you are a married man, whether you are
Midwife.
a midwife, whether
Yes.
you're a doctor, anywhere.
Yes.
This sensitization is for all of us.
Yes.
Let us help our mothers, pregnant mothers, to go to hospital early enough. When you're in hospital early enough, there are very many chances of managing this PPH in case it comes.
Yeah.
Number two, a midwife can carry out what we call uterine massage. Among the causes of this PPH, I mentioned and said uterine atony.
Yeah.
Failure of the uterus to contract. So the midwife can carry out massage of the uterus and can contract and will prevent it. Also, there is prophylactic oxytocin, which I mentioned about. That's why I said anybody who goes to hospital to give birth, as a matter of fact, gets that shot, gets that injection. The importance of that injection is to prevent PPH, to prevent excessive flows of blood. Also, I can't fail to mention monitoring of the risk factors.
Yes.
If you know that this person has coagulation problems, then it calls upon you, the midwife, attending to her, to be very cautious every time monitoring her to see how she's doing. The monitoring issues, the blood pressure, the what, we keep doing those things to prevent our mothers from entering or from going into PPH, which can take up their lives. But most important is for the part of the community, for the part of society, let us make sure mothers go for antenatal in hospitals and go to give birth in hospitals.
Thank you for watching and joining in on this very important discussion. We hope you found this information highly informative. Stay tuned for more episodes of Health Check, and until next time, take care and stay informed. I'm Kan Sobuga, your host, doing the most. Goodbye for now. Assalamu alaikum wa rahmatullahi wa barakatuh.